Health on the Drive.
It's a global observation that helps raise people's awareness.
Insightful tips and information to live in a healthier and happier life.
How to prevent it, detect or treat it.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
If you didn't know, now you know.
This is Smooth Health on the Drive.
Welcome, if you just joined us. This is Smooth 98.1. Love music, love life. This is Smooth Health. On the show today, we're going to be discussing something very interesting, and we would love every single person out there to be a part of our conversation. Today, we're talking about local clinical talents in healthcare, particularly the realities. And like I mentioned, we'd love for you to be a part of our conversation. So before we unveil who our guest is today, let's tell you how to, be a part of our show. You can call the studio lines. Call the number 014489 981. Also, you can send us WhatsApp messages. Please send them to 0809-444-0981.
All right, to speak about local clinical talents in healthcare, we have a special guest, Adedoyin Tope-Daramola. She's the head of human resources at Evercare Hospital, Lekki. Adedoyin is a microbiology graduate, and she also holds a master's degree in human resources and industrial relations. She also has an advanced certificate in HR management from Cornell University in the U.S., where she completed 6 modules: human resources leadership, measuring HR's impact, employee engagement, diversity and inclusion for bottom line performance, building a talent management culture, and aligning HR strategy with organizational strategy. She's a professional member of the ACIPM. Her roles have been across different capacities within the HR space, and she's been in talent acquisition, HR business partnerships, learning and development, performance management, employee relations, welfare, and talent and career management as well. And this has led her to her most recent experience as the head of human resources at Evercare Hospital. She's developed several frameworks and also led transformational human resources projects. She's also a certified coach and career advisor. Wow, Adedoyin, what can you do?
Quite the resume.
Thank you.
Welcome to the show, Adedoyin.
Thank you. It's my pleasure to join you here today.
All right, let's just dive right into it. So, like I mentioned at the start of the show, we're talking about local clinical talents, and we're talking about the realities in healthcare.
Absolutely.
So the first question is, we'd like you to explain to us, what are local clinical talents in healthcare?
Okay, thank you once again. It's my pleasure to join you here today. So what are local clinical talents? I'd like to first of all submit that Nigeria has one of the best teaching hospitals in Africa. And that is why you will observe that Nigerian healthcare professionals are one of the most sought after across Europe and Africa. And if I bring that home, our local talent cuts across diverse disciplines in medicine. We'll have, for instance, internal medicine, where we have subspecialty in neurologists, nephrologists. We have obstetrics and gynecologists, pharmacology, clinical physiotherapists, critical care services, where you also have some subspecialty in anesthetists, critical care specialists, perfusionists, etc. But I would like to say that what is unique to Evercare is that we have some key specialty that are rare to find, in most healthcare facilities in Nigeria.
Such as?
So we have pulmonologists.
Okay.
And I'll explain that. Pulmonologists are those consultants or those professionals that deal with those lung and respiratory concerns. They also conduct sleep studies such as sleep apnea, etc. We have a robust nuclear medicine department. This is like a non-invasive investigation of health issues, where you use waves and all of that to just check what's in there. And in Evercare, in Nigeria today, we have under 5 spec CT scan in Nigeria, and we can say that one of the few facilities in Nigeria that have one in our nuclear medicine department.
All right. Thank you so much for that.
All right. So, I'm curious about this. What are the realities of healthcare practitioners who are actually practicing in Nigeria?
Thank you for that question. I mean, when you say realities, I mean, it almost got me cracking. We all know what our realities are in Nigeria. So not even only in healthcare, but other, I mean,
areas,
other areas as well.
Food, security.
Exactly. So we know what all of those are. But I would just, I mean, we're focused on healthcare. It's not news that healthcare workers are migrating, I mean, for international opportunities, and that's impacting on brain drain, especially in the healthcare market or ecosystem in Nigeria. Issues around inadequate medical equipment, which is impacting on them. I mean, not being able to upskill along with their contemporaries in the international space. That's part of what we deal with.
Finances can also be an issue, yes?
Absolutely.
Okay.
There's also the realities of poor medical facilities in Nigeria. Not to talk about remuneration that is not commensurate with their contemporaries in the international market. That's also a major factor. Then if you now come down to the socio-economic factors, such as, poor housing system, transportation, we have traffic situation, security issues, all of those are, are harsh realities. And what we can say is, as an organization, we are consistently trying to bridge these gaps. Our goal is to transform healthcare in Nigeria and Africa. Evercare Hospital, Lekki, has a unique combination of best-in-class facilities put to use by expert team of professionals to deliver quality care to all our patients. For instance, we have a state-of-art facility that is fully equipped with modern medical equipment, and robust technological infrastructure to support that. And then we have, you can tell that with these efforts, by using that to sort of retain talent in Nigeria, and these are the reasons why Nigerian talent are interested in exploring international opportunities. But we can say that we have that at Evercare, and we've been able to retain talent.
All right,
using that.
I like the fact that you said you've been able to retain talents. But then again, there's also that question. If they're here, how then do they learn what's going on out there? Because every day the world is evolving, it's expanding, there are new technologies, there are breakthrough developments. So I guess my question is, how do medical practitioners stay informed with the current healthcare advancements?
Okay, thank you again. Healthcare is a dynamic field, and it's often considered its own ever-changing and developing ecosystem. Professionals working in healthcare, must be prepared to live in commitment to lifelong learning and continuous skill development. With that, exposure to modern medical equipment has also helped, to sort of give them that exposure. Exposure to international trainings that keep them abreast of global trends in respective categories of medicine has also helped to upskill their clinical capabilities. We have, within Evercare as well, we sort of conduct doctors' engagement and awareness program where you have them share knowledge as to what are the emerging trends, what are the things that are evolving in the healthcare space, so that they come together to share that knowledge. Again, Evercare, we're an integrated healthcare delivery platform. The Evercare Group operates in growth markets across Africa, South Africa, including India, Pakistan, Bangladesh, Kenya, Nigeria, and then we have our global office in Dubai. And one of the things we have done is exchange programs, where we nominate healthcare professionals, to get exposed to world-class trainings in one of our facilities abroad.
How long is your
exchange program?
Yeah, the exchange program.
So it spans from 3 to 6 months.
So what's to say if I was a doctor there, I'd just be like, you know what, this place is better. Why don't I just stay there?
Don't worry, you sign contracts.
Because I imagine if you send me to, I don't know, maybe Dubai, for example, to be like, this place is chilled now. Let me just stay here,
But the value hard is, it comes to a place of impact as well. You've gone there, you're exposed, and you're also willing to come back home to transfer that knowledge and make that impact as well. So it's sort of an ecosystem. So even you as an healthcare professional, you want to make impacts as well. So that forms your research as well, your trainings and all of that. Yeah.
All right. I'm just curious about this. You're the head of HR. What does Evercare actually look for in its professionals, and what kind of skilled professionals do you have? What does your organization have?
Okay. Again, we are constantly. Okay, so when we're looking for talent, for instance, we are key in looking out for people that fit our culture. I mean, we don't want someone to come in and dilute our culture. And one of our uniqueness at Evercare Hospital, again, is that we have all the specialist talent sit in one facility, which is very, very Nigeria. So today we have multi-specialty skills at Evercare. And one of the benefits is that we have interdisciplinary collaboration amongst our specialist talents, meaning, as at today, we don't need to refer any case out. And that is also, that's
any case whatsoever.
Any case whatsoever. Any medical case.
Okay.
Not legal case.
I know. Okay, but go on, please.
So we pride ourselves in that. And for us, part of our strategy again is to ensure that, we're a service organization. So from the gate man to the patient care experience, we're looking for who would fit the Evercare culture. And that is very key for us. And then we in turn are creating an enabling environment for healthcare professionals. We say caregivers. So whether you're in HR, you're in finance, you're in IT, you're a caregiver, and for every of our talents, we're very key in saying that we want the best talents.
So there's a team of people, and you pull the best team of people together in one space all together, from gate man all the way down to
absolutely
the doctors. All right. If you've got questions for our very special guest, well, what you can do is reach out to us on WhatsApp, 0809-444-0981. If you're wondering what we're discussing today, we're talking about the local clinical talents in healthcare, the realities, brain drain, why are people jackpot into other countries, and also what can be done and what Evercare is doing differently. Okay, so like we mentioned, we have Adedoyin Tope-Daramola. Of course, she is the head human resource at Evercare Hospital, and she's answering all our questions. Now, we've talked about, what clinical talents are. We also talked about some of the realities. We've talked about, the advancements where you mentioned, like exchange programs.
Yes.
But let's circle back a little bit. Let's talk about the roles of human resource, right? And this is a broad theme. Mm-hmm. This is one of those things that's not really discussed in medicine. So you being the head of your department, or rather the head of human resources at Evercare, what exactly is the role of human resource management in the healthcare industry, not just with Evercare now?
Okay, I'd say HR is the same everywhere, whether it's healthcare, whether it's finance, whether it's oil and gas, The only thing that is different is the talent that you're sourcing. And I would say that HR has evolved, over time. The profession has changed from being personnel management to being an important part of the strategy of any business. The world of work is also rapidly evolving, as the dynamics of work is also changing. Now we've been able to embrace flexible working patterns for some roles, remote work, We've even seen medicine evolve to telemedicine. You don't literally have to come in all the time, to see a doctor. You can do that over the phone. Well, our key function as HR professionals in the healthcare sector is to strategically hire quality talent to fit the type of culture we're building. Talents to us are all employees, like I said earlier, from the gate man right to the CEO. I also earlier mentioned that we are a service organization, and patient experience, quality of care is key to us. It's very key to us, and so we do not joke with the kind of talent that we bring on board. And then very key for HR professionals as well is to attract the right talent, engage them, motivate them, and develop strategies to retain them. For us as HR professionals, we have also partnered with the business to ensure that, we're right in front of the business. We're proactively supporting the business. So on the spot, we can spot when there are people issues so that we can quickly address that. And then we've been able to create an enabling environment as well. Communicate where we do not tolerate discrimination, bullying, harassment, all of that. And we constantly communicate that. And then recall again that we discussed earlier as regards realities, around healthcare professionals and what we are facing in Nigeria at the moment.
Tell you what we should do, though. We see a break coming, so let's go on that break. When we get back, we'll pick up from where we left off as far as HR is concerned.
This is Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Smooth Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria. This is Smooth Health on the Drive.
It's a global observation that helps raise people's
Smooth
awareness.
Health is powered by Evercare Hospital, Lekki, transforming healthcare in Nigeria.
Okonkwo and his family worked very hard to plant a new farm. But it was like beginning life anew, like learning to become left-handed in old age.
In the world of books and literature, Smooth 98.1 presents to you the very best of African authors.
I'm a storyteller, and I was also
African stories and perspectives with a mix of prose and poetry, drama and thriller, fiction and reality.
I write about things I recognize.
It's 1 hour of inspired literature on the Smooth Book Review. Every Saturday from 10 a.m.
There's nowhere on this earth that compares. Smooth.
Hey guys, my name is Rachel Kerr, and let me tell you about My Lagos. There's nowhere on this earth that compares. From mainland to island to the roadside soya, there's nothing like that. And of course, the sweltering heat from morning till evening. Now in My Lagos, nothing compares to the weddings. Nothing compares to our parties. But one thing I will say is there's nothing like reaching your land of Lagos. My Lagos, your Lagos.
Lagos, jump. Lagos, jump.
Smooth 98.1, love music, love life. Welcome back. And of course, it's still Smooth Health. And if you just joined us, you haven't missed too much, but you might have missed quite a bit though. I'll circle back and tell you what we're talking about on the show today. Today, we're talking about the realities of healthcare in Nigeria. And of course, leading the conversation is our very special guest, Adedoyin Tope-Daramola. Of course, she is the head human resources at Evercare Hospital. Now, just before the break, we were talking about, the role of human resource management in the healthcare industry. So you left off at telling us, the variety of things that that you do. So circle back and let's talk about that a little more.
Okay, so we're still talking around the role of HR professionals, and I'd just like to circle back to when I mentioned the harsh realities the healthcare professionals are facing in Nigeria and its resultant effect on brain drain. It's our role as HR professionals to constantly engage the business, to proactively respond to people's issues rather than being reactive. If we take a look at, the attrition rate within the healthcare sector, a good percentage is around 20 to 22%, and it's even higher for nurses. But I can confidently say that
higher for nurses. Yes. Why? Why is it higher for nurses?
It's easier for them to,
no, let's put it out there. Let's call it spade a spade.
Yes, it's easier for them to jackpot. For doctors, you have to do like several levels of examination before you can, and then, evolve into the international market. But for nurses, I think
so it's easier because they're easier. Okay.
So, for us, I can confidently say that our attrition rate is below 10%, and that's kudos to us. That's why I said we have been able to retain our talent. And, we also understand that human needs are dynamic, and as such, we tell ourselves we may not be able to solve everyone's issue, but we have been able to build, our talent pipeline, and we have key succession strategy, especially considering the fact that we have a high number of critical roles within our organization. Again, we're healthcare, and we can afford to tell people that this consultant is not on ground or that is not available. So we have that pipeline of talent.
So I want to ask this question. So if a major consultant is not around, there's always a replacement. There are 2-3 people that's always assigned to. How many people are assigned to a patient?
So is it nurses now or
so I'm looking at the medical practitioners, I'm looking at the doctors now.
You have to schedule an appointment with a doctor. Or you always have a doctor on call.
Okay.
So they run shifts, but you will always have a doctor on call. Yes, so even if one is not available, there's someone else that is available, and then we run a system where you book ahead or we schedule a patient. But for emergency services, we have consultants on call, ready to attend to for emergency cases. So, we have our patients covered.
All right.
Again, quality patient experience is key. Quality care.
And with regards to the employment situation in Nigeria, a lot of people are looking for an opportunity, the next gig, and with the brain drain, there's still people coming out of school who are hoping to get employment. And there's an idea, in some industries, you need to know someone before you can actually get a job. So if someone wants to work at Evercare, what do they need to do?
Okay, again, if you're listening, if you go on our website, we have a link where you can click to submit your CV. I'll also like to reiterate is you don't have to know anyone at Evercare for you to get a job at Evercare. Just go on.
I like the way you put that out there. Okay, go on.
Absolutely. It's equal opportunities for everyone. We've created an enabling environment. As long as you have the skill, again, you fit into the kind of quality of talent that we want, then you have a space at Evercare Hospital Lekki. You can also send your CVs to careers at evercare.ng.
Okay.
Yes.
Careers at evercare.ng. So outside doctors, nurses, midwives, there's a role for everyone separately.
Absolutely. So again, Evercare is not, we are a world-class organization, things are done properly. So we have robust, non-clinical team that are very robust as well. We have unique IT team, HR team, finance, business development and marketing, corporate communication, very robust. So even if you're not, beyond clinical talent, we have the best. One of the best talents across.
It's okay to brag and put it out there.
Toot your horns.
Yeah. And again, part of the things that we're also doing is building partnership with schools so that we can get
building partnership with schools.
Yes, with higher institutions.
Okay.
So where we can get their medical talent as well. Best graduating students, so that you can come on board, whether finance, whether HR, whatever it is, you have a place at Evercare. So it's not just limited to clinical talents alone. So we have non-clinical roles as well, and I'd like to reiterate that.
All right, we've got a message from Taiwo from Ogba. He says, does Evercare Hospital operate on the mainland?
Okay, so as at today, we only have one facility in Nigeria, and it's located at 1 Admiralty Way, Lekki.
All right. Okay, real quick though, we're close to wrapping up this side of the show. However, we just want to reiterate what we're discussing on the show today. By the way, this is Smooth Health on the Smooth Drive with Zibi and Kaide. We're talking about local clinical talents in healthcare, and particularly we're talking about the realities. Now, like I mentioned at the start of the show, you highlighted the importance of what local clinical talents are and also the types you have at Evercare. So I want you to highlight that again for those who just joined the show.
Okay, in Evercare Lekki, we have multi-specialty talent. So whatever diverse specialty you have in medicine, we have them in Evercare Hospital. So whatever it is, whatever line of medicine that you're on, you find them in our facility.
Can I think of one and just put it out there?
Okay, so think of it. Or do you want me to help you to list? Do you want me to list it out?
Possibly.
Okay, so let me bring it out to you. Don't make me laugh.
Okay.
Okay, so if you're looking for an anesthetist, critical care consultant, general surgeons, neurosurgeon, obstetric and gynecologist consultant, pathologist, endocrinologist, cardiologist, interventional cardiologist, family medicine consultant, neurologist. Do you want me to go on? Pulmonologist.
Okay. So fair enough. There is a large pool of talents that you have
Absolutely.
at Evercare. And also we talked about something earlier. We talked about the brain drain. We talked about why skilled professionals are leaving. So generally, I want to take this conversation away from Evercare and talk about the Nigerian system. What do you think can be done?
What can be done? I mean, like I said earlier, the harsh reality is not only healthcare. Before joining the healthcare, I was working in the financial services, and I can tell you that attrition was also high. You see people not even moving into an organization, but jackpotting, like you said. It's a jackpot syndrome. So what can be done? I think we need the government to look into, how can we strengthen workforce, for instance? How do we work on remuneration? Basic wage, minimum wage, etc. Those are the things that we need to look at. How can we ensure that security is, firm, roads are good, less traffic, because sometimes you see people, even in oil and gas industry, say, I'm resigning and I'm jackpotting. It's not because they're not earning well, but because of other social economic factors. Can we have more health, world-class healthcare in Nigeria? Can we have good road, access to good road, etc.?
All right. Can you tell us how anyone who's listening can actually contact you at Evercare Hospital?
Okay, for everyone listening, and if you're interested in whether careers or as a patient you want to come and experience life or experience what it's like at Evercare.
Experience life. Okay, that's a new one.
Even if it's wellness, yes, wellness check, do your annual medical checkup and all of that. Come and experience, a difference. We are located at number 1 Admiralty Way or Bisola Dro Simieti Drive, Lekki Peninsula, Scheme 1, Lekki, Lagos. Or you can also check us on our website at www.evercare.ng. You can also reach us on 0813 985 0710.
All right. Just before we let you leave, though, we noticed there's something for midwives on your website. What's that about?
Okay. We just recently got our... Okay, so we just recently got partnership with the Nursing and Midwifery School. So now we can take on, for nurses that just finished school, they have a compulsory 1-year internship that they're supposed to do with their temporary license. So they can now come on board. They're welcome at Evercare now. I think we now have a link on our website where they can go on, drop an application, and then submit necessary documents, and then they go through some assessments before we now have our final pick. But that's what we just recently got.
All right. Thank you so much for that. We've been discussing with Adedoyin Tope-Daramola. She is the head human resources at Evercare Hospital. And like we mentioned, we've been talking about the local clinical talents in healthcare, the realities. Thank you so much to Adedoyin. We look forward to having you here again. And we'll discuss it more as far as healthcare is concerned.
Okay. Thank you very much for having me. It's been a wonderful time with the two of you this afternoon. Thank you.
Thank you for coming. And that's it for Smooth Health on the Drive on Smooth 98.1. The rest of the show continues.
Smooth Health on the Drive.
It's a global observation that helps raise people's awareness.
Every Thursday at 5:15 p.m.
If you didn't know, now you know.
Powered by Evercare Hospital, Lekki. Transforming healthcare in Nigeria.